Now, childhood immunization has proven to be one of the most sustainable and cost public health strategies that has helped prevent deaths among children worldwide now. However, misinformation and other obstacles continue to threaten gains made in combating vaccine diseases among millions of children globally, calling for the urgent need to counter the virus. Experts warn is fueling hesitancy and even efforts to vaccinate children, as explained by Gloria Milimo on this episode of Health Digest. Take a look.
It's the last day of the 16 days long nationwide vaccination campaign against typhoid and measles, targeting children between the age of 9 to 59 months for the measles rubella vaccine and those aged between 9 months and 14 years for the typhoid conjugate vaccine. At the Dagoretti Sub-County Hospital Mutuine in Nairobi, parents, along with their children, rushed to beat the countrywide deadline of the inoculation exercise that has seen a new addition into the national immunization schedule, the typhoid conjugate vaccine. The launch of the vaccine, alongside the measles rubella that protects against the highly contagious disease, marking yet another great step towards protecting children against vaccine-preventable diseases like typhoid. Gertrude Wainaina, a resident of Dagoretti Sub-County, is among parents who have brought their children to receive the crucial jab. For her, the vaccine is a lifeline for her vulnerable daughter.
So when I watch into TVs, naonanga pahali hiyo ugonjwa ikishika watoto vile inakuwa. So nikaonelea ni vizuri mtoto wangu apate hiyo chanjo.
This, according to experts, is a step towards curbing the disease that continues to afflict thousands of families, especially the ones from the informal settlements and rural areas with poor access to clean water and sanitation.
I can conclusively say that for typhoid, we've managed to immunize more children than for the measles, but generally the uptake has been so good for the campaign, for the period we've been having the campaign.
Even though there's an increase in the number of children being vaccinated, experts warn that rising misinformation continues to threaten to further stall or even reverse progress made in protecting children against diseases.
Routine vaccines have prevented deaths of millions of children worldwide. However, Kenya still grapples with vaccine hesitancy, and experts warn that this could slow vaccination efforts and even progress made in preventing deaths among children.
The first few days, we experienced some hesitance, especially for typhoid vaccine, because it's a new vaccine that is being introduced in the public hospitals. We can say from the 10th to the 16th day, the uptake was good.
Public health experts warn that misinformation and any forms of vaccine hesitancy is a reflection of lack of trust or mistrust in the very medicines designed to protect one from preventable illnesses. Dr. Aidil Shah is a pediatrician and infectious disease specialist at the Aga Khan Hospital in Nairobi. He says that childhood vaccines play a vital role in protecting children against diseases, given that they are always at risk of infections.
The reason that we vaccinate children is because the risk of disease in children generally is higher because the immunity is not yet formed and they are generally vulnerable to severe diseases. So we try and get these vaccines early on in childhood so that we can protect them from common illnesses that we find in the community, such as pneumonia, diarrhea.
He warns that parents who are exposed to misleading claims regarding how vaccines interact with the body may become reluctant to have their children immunized, and this can have severe repercussions.
On the other side, we have seen very many children come into hospital who have not been vaccinated for simple things like a pneumonia vaccine, come in with severe pneumonia, come in with severe meningitis. So why take that risk when you know this works?
A recent report by the World Health Organization and the United Nations Children's Fund, UNICEF, revealed a major decline in routine childhood vaccination coverage in 2024. At least 133,000 children in Kenya missed out on essential vaccines during that year compared to 2023, when 90,000 fewer children were unvaccinated. Statistics also indicate that Kenya recorded at least 3,000 cases of measles and 18 deaths between February 2024 and February 2025, highlighting the need to increase efforts to vaccinate children and counter misinformation.
We have been using them, and we have seen the benefit. I don't think there has been anything that has worked better in terms of preventing disease. Probably the most remarkable, technology that has come in modern medicine has been vaccines, because nothing has saved more lives than vaccinations. Whenever vaccines are administered, we do advise parents that, okay, these are the common side effects your child will experience. They'll have pain, they'll have fever, they might have a bit of redness around the site. If it's a mild side effect that's persisting, do check in with your healthcare provider.
Overall, vaccines don't save lives. Vaccination does. Experts say we can have the best vaccines, but when they stay on the shelves and are not administered due to hesitancy, they have no effect. And so, if your child is due for any vaccination, take the bold step of helping protect them from preventable illnesses by having them vaccinated. Gloria Milimu, KTN.